the dissection of the pectoral region. The pectoral region, first you see the landmarks. Here is the sternum. It has got a sternal notch, and below the sternum, this is your manubrium sterni, and body of the sternum, and the GP sternum. One of the characteristic of the manubrium sternum is it is a part of the, or it represents discontinuous dermatome. There is a term known as discontinuous dermatome. What is dermatome? When the portion of the skin is supplied by a single spinal nerve. That is known as dermatome. So you have seen that zebra type striping of the human body. In this way, the dermatomes are there. Now, above the sternal angle, this area is supplied by C4, and below this angle, sternal angle, that is T2. From C5 to T1, they are dragged towards the brachial plexus. So here the transition between the two discontinuous dermatomes. Above is C4, below is T2. But the continuous means C4, C5, C6 like that. Above is C4, below is T2. So discontinuous dermatome, number one. Then you have to give a midline incision or paramedian incision. Paramedian means side of the midline. So paramedial incision, that is your longitudinal, and one horizontal incision over the clavicle. As you know, the clavicle bone is subcutaneous throughout. You have to give a that is horizontal incision over the clavicle. Then another horizontal incision from the zippered process to the posterior axillary fold. Here is the posterior axillary fold. Then third incision surrounding this nipple, you have to extend up to the anterior axillary fold. Now you see, this is the nipple, areola of the nipple, and this is the breast. Breast is developed in female and rudimentary in case of male. And this nipple and the breast, it is present in the superficial fascia. Breast is a modified sweat gland. Breast is a modified sweat gland. It is present in the superficial fascia. So skin, then the superficial fascia. You have to remove the skin. Now skin is removed and breast is there. You see, these are the superficial fascia. Below the superficial fascia is deep fascia. The deep fascia of this pectoral region is known as pectoral fascia. Pectoral fascia. After removing the pectoral fascia, you will encounter a fan-shaped muscle here. The muscle, it has got a sternal origin, it has a clavicular origin, medial half of the clavicle. Then the sternal head, it starts from the first, that is costal cartilages, first to sixth costal cartilages, as well as taking origin from the external oblique aponeurosis. That is your pectoralis major muscle. Pectoralis major muscle. Now this pectoral, you see how this breast is sitting over the pectoralis major muscle. Okay. Now it is removed. This is your pectoralis major, and below the pectoralis major you will see another muscle is there. That is your pectoralis minor muscle. Pectoralis minor muscle taking origin from the third, fourth, fifth ribs. Third, fourth, fifth ribs, and it is, you see the how the medial pectoral nerve is supplying the pectoralis major by piercing the pectoralis minor. Pectoralis minor. It is piercing the pectoralis minor by the process of pierce. When it pierces, it supplies the pectoralis minor. Then pectoralis major. And this one is your lateral pectoral nerve. Lateral pectoral nerve is laterally oriented and it supplies the pectoralis major as well as pectoralis minor. So one nerve, lateral pectoral nerve, laterally oriented. From the lateral side, it supplies pectoralis minor and pectoralis major. And the medial pectoral nerve, it comes and it pierces the pectoralis minor and supplies the pectoralis minor. Then it supplies the pectoralis major. So that is the thing. Then another thing here, this is your pectoralis minor. pectoralis minor, and here is the this you see this is the muscle is there, that is your subclavius muscle. Subclavius muscle taking origin from the first rib, from the costal cartilage of the first rib, inserted in the under surface of the clavicle. In the under surface of the clavicle there is a groove, that is subclavian groove, and the base of the subclavian groove receives insertion of this is the insertion of the subclavius muscle, and both the side, both the lips, there is a fascia, both the side clavipectoral fascia descend down, and after enclosing the subclavius muscle it joins together to form the clavipectoral fascia here, clavipectoral fascia here. Again it splits to enclose the pectoralis minor muscle, pectoralis minor muscle. So this area, clavipectoral fascia, is pierced by four structures. The nerve is lateral pectoral nerve, then artery is acromiothoracic artery or thoracoacromial artery, then comes that is your cephalic vein, and the lymphatic, central group of lymphatic, when it enters to the apical group, it pierces the clavipectoral fascia. So these four structures, they are piercing the clavipectoral fascia. You can see some of them. This is your lateral pectoral nerve and acromiothoracic artery, along with acromiothoracic artery, lateral pectoral nerve, and cephalic vein. Cut end of the cephalic vein is there. It is of course missing. So these are the three structures, and usually you are not seen, the lymph nodes are not seen in normal cases. Lymph nodes are just like your soldier base of the soldiers. So what happens when there is infection and inflammation, more of lymphocytes, they are coming, they are soldiers in our body. The lymphocytes are the soldiers, they are congregated in one area, and that swells. When it swells, it gives tenderness to us. Otherwise, the lymph nodes are normally not seen during the process of dissection. You see the lateral pectoral nerve here. This one, the lateral pectoral nerve, then musculocutaneous nerve, lateral root of the median nerve, three branches. Then the medial cord, coming to the medial cord, which is medially present to the axillary artery. This is your medial root of the median nerve. Then comes another one is your medial pectoral nerve. This is the medial pectoral nerve, medial root of the median nerve 2. Then comes your cutaneous nerve of arm and forearm. This is the cutaneous nerve of arm and forearm. There is a thin one. You see, this is the cutaneous nerve of the arm, and this is cutaneous nerve of the forearm. So cutaneous medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and continues as the ulnar nerve. Here. This is ulnar nerve. Now this finishes your medial cord. Then coming to the posterior cord, which is posteriorly present to the artery. You see, this one is the tubular structure, the tube-like structure, collapsible tube-like structure. A turn here. You can see the lumen here, because during the process of dissection it is torn. The lumen is visible here. So this is definitely a artery. So this is axillary artery, and the axillary artery, below this axillary artery there is another cord, that is known as posterior cord. The branches from the posterior cord, from above you have to trace. So upper subscapular, you see, upper subscapular, lower subscapular, upper subscapular, then comes lower subscapular, and you have to trace this one. This is latissimus dorsi, and the nerve is here, thoracodorsal. You see, this is thoracodorsal. So upper subscapular, lower subscapular, thoracodorsal, or upper subscapular, then comes thoracodorsal, then lower subscapular. So lower thoracodorsal is in between the upper and lower subscapular. So in the orientation, upper subscapular, thoracodorsal, and here is the lower subscapular. Upper subscapular, thoracodorsal, then the lower subscapular, and to the lateral side you see a branch is running to the, you see, another branch is running towards the deltoid as well as the teres minor, which is axillary nerve. Axillary nerve. So upper subscapular, thoracodorsal, lower subscapular, axillary, and radial. It continues. This nerve, the posterior cord, continues as the radial nerve. Radial nerve. Now coming to the axillary artery. This is the axillary artery. The axillary artery, and axillary artery is divided into three parts by pectoralis minor. Above the pectoralis minor, first part. Below and behind the pectoralis minor is second part. Below is third part. In the first part, you will encounter, you will see the superior thoracic artery, which is torn out in the process of dissection. Here is the place of the superior thoracic artery. Then comes your acromiothoracic artery, acromiothoracic artery, and lateral thoracic artery. Acromiothoracic, lateral thoracic artery. So this is your artery. The talks are there. One is your acromiothoracic, one is your lateral thoracic, and below you see here there is a branch that is descending down. You see the branch is descending down. This artery is your subscapular artery. Subscapular artery, and the subscapular artery gives a circumflex scapular artery towards the scapula. Then it travels down and supplies the this muscle, that is your latissimus dorsi. This is your subscapular artery, and by the side of this subscapular artery, to this is subscapular, and opposite to the subscapular artery there are two branches. One is anterior circumflex humeral, another is posterior circumflex humeral. Anterior circumflex humeral means the humerus, it surrounds the neck of the humerus. Surrounds the neck of the humerus. One passes anterior to the humerus, another passes posterior to the humerus, and the anastomos there. So anterior circumflex humeral, posterior circumflex humeral, and the subscapular. These are the three branches of the third part of the axillary artery. So axillary artery, this is your cord, and you see here is the thin axillary vein. This is the axillary vein, thin one, and its tributaries.